Okay, we are going to talk today about um, more of Chapter 2, the structure of the treatment relationship. Specifically, we're going to talk about forming the patient-physician relationship or the provider-patient relationship. And you may hear me call it the PPR. Okay? In most situations, it's easy to determine if the patient-physician relationship's been established, but sometimes it's not always so obvious. You know, does a telephone call count as creating the PPR, or is a conversation at a cocktail party, does that create a patient-provider relationship? What about the doctor that gets called in by another doctor to consult, but who never actually sees the patient? Or what if he does examine the patient, but she does so on the direction of an insurer or an employer, some third party? Is she obligated to the patient or to the third party? What if the patient-provider relationship has been formed? Does the physician have an obligation to third parties who might be harmed by the physician's professional decisions? Okay, those are some of the questions that we are going to talk about today. Okay. Have you noticed lately that in the last few years, anytime you call a doctor's office, you always get a message now. You get to talk to a live person at the beginning, and it says to you, call 911 if this is an emergency. Well, why do you think that they do that? Okay, I'll let you think about that for a minute while I check and make sure that our video is still recording, and it is, and I need to go back because it's too up close. So, why do you think they do that? Well, after we talk about these cases, I think you'll have a better understanding, but they want to be very, very clear that just because you called the office, it did not establish a provider-patient relationship, okay? There is no rule of law that requires that a physician undertake the treatment of every patient who comes to them, okay? We've already talked about that some. Another example of this case, of this situation, is a case called Clanton v. Von Hom. It's not in your text, so nobody was assigned to do it, but it was in the previous text. The patient goes to the ER with back pain. They're given pain medicine and sent home. Her condition continues to worsen. She calls the doctor. He refuses to make a house call. She continues to deteriorate and becomes paralyzed. Okay? The defendant, the doctor, argues that there was no patient-provider relationship, and he was granted summary judgment, and the plaintiff appeals. The plaintiff appeals, stating there were two genuine issues of material fact that should have gone to trial. One, did a patient-provider relationship exist, and was the defendant negligent in treating the plaintiff? Okay. The simple recitation of symptoms and return of the phone call did not create the provider-patient relationship. Okay, and the appellate court says trial court didn't err by granting the summary judgment. The next case you did have in your text, and it's an interesting one, but tragic, so many of these are. Adams v. Via Christi Regional Medical Center. Plaintiffs filed an action against the hospital, Via Christi, and the physician, which I'm going to butcher his name, Dr. Holbesum. The plaintiffs ended up settling out of court with the hospital, but they continued their action against the physician. The plaintiff's 22-year-old daughter was 5 to 8 weeks pregnant and had begun having abdominal pain. The plaintiff mother contacted defendant, who was the plaintiff's doctor, and who had not seen the daughter as a patient for over 4 years. And during that time period, the defendant had decided to stop delivering babies and had notified all of his current patients that he would no longer deliver babies. Okay, but the plaintiff claims she never received that notification. According to the defendant's testimony, the defendant told the plaintiff that abdominal pain is not uncommon during pregnancy, but they should go to the ER if the pain worsened. He also stated that he told her to see a doctor the next day. Plaintiff testified that he told her to bring the daughter to see him the next day. Both parties testified and agreed that the defendant did not ask any questions about the daughter's condition. Several hours later, she worsened. The plaintiff takes the daughter to the hospital, where she becomes violently ill. She goes into cardiac arrest. She's taken into surgery, lapses into a coma, and was on life support. The defendant wasn't notified about the patient's condition until the next afternoon. He immediately goes to the hospital, takes a look at the daughter and talks to the plaintiff's parents and says, she needs to be removed from life support, and she dies less than 24 hours than everything started, the situation started. Turns out she had an ectopic pregnancy, which is a condition that usually becomes evident around the 8th week of pregnancy. There was testimony that if the patient had received medical care around about the same time that the plaintiff had contacted the defendant, then the patient might have survived. Plaintiffs sued the defendant for medical malpractice and wrongful death. The defendant says or contains that there was not a patient-provider relationship, so there was no duty. Okay? The trial court relied on the defendant's own statements that he did discuss the patient's condition with the plaintiff, and by doing so, the trial court says he was consenting to give medical advice on the patient's condition. And it was immaterial that he had not seen the patient in 4 years. It was immaterial that he did not speak directly to the patient. It's not significant that neither he nor the patient considered him to be her doctor. The patient had completed a form earlier that month with Planned Parenthood where she had stated that she did not have a physician. Defendant did not direct the plaintiff to contact another doctor. He gave his medical opinion. Okay. The court stated that the defendant's undertaking to render medical advice as to the patient's condition gave rise to a provider-patient relationship. So even if the earlier relationship or the provider-patient relationship had lapsed, it had then been renewed, and he had a duty to care for the patient. Now, you're going to see with these cases that the courts are very conflicting about when they say patient-provider relationships are formed. In the next case, a state of Kundert. The plaintiffs are relying on that Adams case to try and persuade the court that a physician-patient relationship was established. The plaintiff's son was a 6-week-old baby boy who started showing signs and symptoms of serious illness. The plaintiffs were unable to reach their son's pediatrician, so they contacted the defendant hospital. Plaintiff asked when she called that she could speak to a medical professional. She was transferred to the ER where she told an unknown individual on the phone that her newborn was running a high fever, very fussy, wouldn't sleep, wouldn't eat. The unknown individual told the plaintiff that she was overreacting, she needed to give the baby tepid baths and Tylenol, but she was unsure as to the dosage, telling her to call a pharmacy. The individual also told the plaintiff that the hospital did not have the equipment or personnel necessary to care for an infant. Defendants ended up taking the baby to the pediatrician the next morning, and a pediatrician sent the baby by ambulance to the defendant hospital where a lumbar puncture was done, and the baby was immediately transferred to another hospital for a higher level of care and was treated for meningitis and ended up dying 15 days later. The plaintiffs argued that a relationship with the defendant, that there was a patient-provider relationship, and that the defendant owed a duty of care because the person on the phone recommended the Tylenol and the tepid bath. Remember, the defendant is the hospital in this situation. The court stated that it failed to see the actions of the person on the phone, even when viewing the allegations in the light most favorable to the plaintiffs, which you have to do on a summary judgment motion. There was no knowing acceptance of the baby as a patient. The court said that the individual on the phone didn't interpret any test results, didn't examine the child. She simply gave an informal opinion. The court said that if they were to find a patient-provider relationship was created from coupling a patient's inquiry with an informal opinion, it would have a chilling effect on the practice of medicine. They went so far as to even say that doctor's office would basically tell you to hang up and call 911 anytime someone called with a fever. But as I said at the beginning of this lecture, that's really not that far from the truth of what happens now. The court said that public policy supported the trial court's decision to grant summary judgment to the defendant. Okay? The plaintiffs tried to rely on the Adams case and other telephone call patient-provider relationships in their arguments to the court, but the court said that the patient has to knowingly seek the provider's service, and the provider must knowingly accept the patient. The singular act of dispensing advice does not equate to knowing acceptance of a patient. Okay, so here you go. It looks like we've got some conflict between Adams in this case. Of course, they're from separate jurisdictions, so they're not bound by one another. But the court does address the Adams argument, and they say that this case is different from Adams because in that situation, the court had found that there was a question of fact for the jury to decide. But here, the person on the phone clearly stated the defendant hospital didn't have the resources to treat the child. There was no question of fact because both sides agreed that this was conveyed to the plaintiff. Okay? So there is a minute difference between the two. The Decatur case, the Reynolds, the Adams case, while on its face doesn't seem that different, all that the Adams case said was that it could go to trial. There was a question of fact that could go to trial. We don't know if they actually recovered anything at trial and that the physician was found liable. Our case, the appellate case, is only focusing on whether or not summary judgment was reasonably granted. And in this case, they're saying, yes, summary judgment was reasonably granted in this particular case. And the next case is Reynolds v. Decatur Memorial Hospital. And here the issue is whether or not a patient-provider relationship is established even if the defendant only consults with the actual providing physician but never actually sees the patient. Here we have a healthy 2.5-year-old who was jumping on the couch and fell off of the couch. Okay. A couple hours later, he was brought to the ER because he was lethargic and had an abnormal breathing pattern. They ran tests, they did neck x-rays, everything appeared normal, but the child was admitted and a pediatrician was called in to examine him. The child was running a high fever, but he was able to move his head and his neck was not tender. Many diagnoses were considered, but the physician was leaning towards some type of infection because there was a fever. She never considered a spinal cord injury because such an injury just wouldn't normally happen to they just weren't common for a 2-foot fall in a normally healthy 2.5-year-old. I mean, how many of us have children or have seen children jumping on the bed, on the couch, and falling, and, you know, other than maybe a bump on the head, maybe a broken arm, nothing that serious. Here the physician telephones the defendant, who is a neurologist, calls him at home, and she tells him that this child has walked after the fall, has an elevated temp, is flaccid but responsive, and that the surgical spine x-rays were normal. Defendant then asked, after discussing possibility of child abuse, where the pediatrician rules that out, defendant asks if the child's neck is stiff. Physician goes and checks, returns, and says that it is stiff. So defendant suggested a spinal tap to check for meningitis, encephalitis, or something similar, which would explain the stiff neck. The physician didn't ask the defendant to treat the child. The defendant didn't commit himself any further. Defendant just considered this a courtesy to his peer. He didn't bill for the service. Neither the physician nor the hospital ever contacted the defendant again about this child. The plaintiffs never contacted the defendant about the child. Okay? The pediatrician determined that the likely cause for the symptoms was an infection, but the child did have a spinal cord injury that left him quadriplegic. Basic negligence law, malpractice law, says that there must be a duty owed by the physician, the provider, to the patient. A breach of the duty and some injury proximately caused by that breach and then resulting damages. This court said that whether there was a duty is a question of law, and that a doctor who gives an informal opinion at the request of a treating physician doesn't owe a duty of care to the patient whose care was discussed. If a duty is found, once again the court says, chilling effect upon the practice of medicine. It would stifle communication, education, and professional association, all to the detriment of the patient. The court also stated that the patient must knowingly seek the physician's assistance and the physician knowingly accepts the person as a patient. We've already had a court to say that. So, what's difficult for us to understand society, when I say us, is that just because you have a bad result, even unfortunately if it's a child, horrible things happen, and it's not always um, the liability on the physician's part. Now, given that, just from this case, we get that a peer consultation doesn't necessarily create a physician-provider relationship, are we then saying that the patient receives the benefit of free consultations, but they pay for the consultations by waiving their right to sue the consulting physician? Many courts have avoided this debate of whether a PPR has been formed by saying that a physician owes a duty to the extent of his or her involvement, whatever that is, in the case. Generally, there's no physician-provider relationship when the physician is examining a patient for a third party. One case that supports this is from Georgia. It's Payne v. Shearer, which involved the rejection of a malpractice claim when the independent medical exam after a workplace accident failed to detect abnormalities. So the court said the doctor owed nothing to the patient because the relationship was actually with the workplace. Okay, many courts have said, you know, while the physician may not have an affirmative duty to a patient, the physician does have a duty not to harm the plaintiff. Okay, some examples. There's a Texas case where an employee lost their job because the physician misrepresented the employee's health condition after an exam related to a promotion. So you don't have to, you know, it's more about you can't cause the injury. And there are a few states who have allowed malpractice claims to go forward in the absence of a patient-provider relationship. Okay. The next case is in Lyons v. Grather. The court examines whether a physician-patient relationship, whether it was created, is a question of fact, and it turns upon a determination of whether the patient entrusted his treatment to the physician and the physician accepted the case. Okay? The facts of this case were plaintiff was a blind woman who had an appointment with the defendant. She arrives at the defendant's office with her son and her guide dog. She's told that the defendant will not see her unless the dog's removed from the premises. The plaintiff insists that the dog remain because she can't be assured that the dog will be safe or whether she'll have access to the dog following the appointment. Defendant turns the plaintiff away, refusing to treat her condition, which was a vaginal infection. Plaintiff claims she was humiliated in front of other patients in the office. Her condition worsened during the 2 days that it took her to find another physician willing to see her, and that she had great pain and suffering. Plaintiff claims that she's entitled to damages due to the defendant's breach of his duty to treat. Trial court dismisses. It gets appealed. Here, the court talks about the majority of courts agree that in the absence of a statute, a physician has no legal obligation to accept a patient to every patient who seeks his services. That there's only a duty if physician-patient relationship is formed and that relationship springs from some consensual transaction between the two. Okay, and whether or not the PPR is created is a question of fact. You have to determine whether the patient entrusted his treatment to the physician and the physician accepted the case. Seeing the pattern here, Having an appointment on its own is insufficient to create a PPR. It means nothing more than that the physician agreed to see her. However, here the patient stated in her complaint that she had an appointment for the treatment of a vaginal infection. This would indicate that the plaintiff had sought and defendant had granted an appointment at a designated time and place for the performance of a specific service. The fact that it might later be contradicted at trial is irrelevant. Okay? The elements for the cause of action have to be alleged, and if you meet those elements in your allegations, it doesn't matter that it might be refuted at trial. That creates a question of fact. What if there's a clear patient-provider relationship, but the treatment decisions affect third parties? Okay? This is a situation not where the physician owes the duty to the third party, such as when a physician looks at an employee on the behalf of an insurance company. Here, does the physician owe a duty of care to somebody who is not their patient and who may be a complete stranger? These cases are broken down into two types. Whether or not a physician owes a duty of non-negligence to third parties versus where a physician has a duty to warn third parties. Okay? Owes a duty of non-negligence or a duty to warn. Courts have generally recognized that there's some duty of non-negligence to third party, but they really differ on the extent of that duty. There's three main theories that the courts follow. Either the injury that results has to be something reasonably foreseeable, or some courts say that there's a special relationship between either the patient and the third party or the physician and the third party. Or some courts have said there must be some sufficient ability and authority to control the conduct of the patient. Some of the most common cases relating to these types of situations are car accidents where the driver was on some type of medication that's been prescribed by the physician, kidney donor cases where the donor is suing the physician, genetic disorder cases where physicians fail to diagnose a genetic disorder in one child, and then the parents have another child, and that second child has the same genetic disorder because they weren't told or diagnosed in the first child. That's where we will stop today, and then we will pick up on our next video at how you can limit the scope of the treatment relationship.